into Australia. This is again looking at the social, some like community type issues. Medicare uh, supports a process called bulk billing, where attending a GP is effectively free for Medicard holders if the GP supports it. Otherwise, you pay the fee and you might get a gap back. So, in other words, the government then funds a portion of the cost of the visit, or you pay the full fee and just suck it up. When that's costing you $100 for a 15-minute appointment, yeah, getting the gap back is quite good. But Medicare has a degree of obligation on the practitioner to meet certain standards, reporting, blah, 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 blah. Now, bulk billing is, like I said, it is a means generally for low income citizens or people who have some form of extra need or families or that sort of stuff to help further offset costs, and those visits are free. But specialists and imaging and things like that generally don't get bulk billed. They have a gap. Sometimes there's no gap. But yeah, certain sections of the community attract even more support. So disability card holders will generally attract bulk billing wherever they go, and veterans will often attract the equivalent of bulk billing. Now, it depends on the degree of the veterans card you hold. Australia has basically, when it comes to subsidised healthcare, a white card or a gold card, and that's based on the degree of service injury, degree of service completed, etc. And it will then impact the degree of cost that you bear for the services you then go and pay for or receiving. Gold card holders are kind of seen as not, I won't say cream of the crop. It's not a situation like that. They are veterans whose medical conditions are such that they receive fully subsidised healthcare for life. So a gold card holder should not be paying for any medical care received. Well, I think it's like 95% is covered. There's some stuff that apparently isn't covered. A white card holder will pay for some specific treatments, but others are fully covered. Not blanket. I think it's got to be service-related type stuff. But the gold card is kind of like it evolved out of systems previously where wounded veterans returning from conflict were given certain support infrastructure when they got home. Sometimes that infrastructure wasn't very good, and so over time these systems have evolved through our Department of Veterans Affairs. I've read about stuff in the US under the VA, and I don't know the name of the system in the UK, but I've read about examples in the UK where wounded veterans have received varying levels of ongoing support and care, etc., going on. To suddenly find yourself in a position where you're, especially if you're living in regional Australia, where your eligibility for free or completely subsidised healthcare has now disappeared, can be difficult, especially when there's GPs are not supporting it anymore. And, well, I mean, this is Canberra. Canberra's regional, but it's considered urban. It's considered a big city. So it's interesting. We'll go with interesting. Yeah, interesting is safe. That we have, especially with medical discharges and things like that. So, let's see, what will it tell us what card she was on? No, she's on a healthcare card, so it could be a white card. Okay. Now, I will tell you, because the GP I used to see used to accept, they changed their bulk billing practices, and then as part of changing their bulk billing practices, they also changed their willingness to accept other subsidised services, i.e. veterans cards. And so there were veterans who left that medical practice because they no longer were receiving the healthcare that they're entitled to, which then put a burden on other general practices in the area, because now they had an influx of additional patients, often with complex medical needs, that would have placed an added load on their practices. Now, it says here that the department, and this is coming from the ABC, so again, we've talked about which way they lean. Spokesman for the DVA says there has not been a decline in the number of health professionals willing to see veteran patients. Okay, that's an interesting statement. Now, does the statement follow on? Was that immediately followed, or was it separate? Was there a full stop between the two? Just because the doctor is willing to see you doesn't mean they're willing to take payment or accept eligibility of your services card as the payment, because DVA pays on a different scale. I mean, Medicare also pays on a different scale too. So GPs who take private patients or take private payment only can, well, by and large, set their own scales. Not too much. I think the AMA cracks down on them. But if they're taking Medicare payments, generally they're set and restricted to what the fees can be. And then if they've got people paying a gap, the gap is pretty much set. And then obviously you've got these fully subsidised health cards. So the statement that there's many Canberra GPs and specialists to accept the veteran card as full payment for services. Okay, that may also be true, that a disabled or wounded veteran can still access healthcare services in Canberra across the spectrum of need. Might also be true, but it can also be true at the same time, under those two statements, that there are GP services that have withdrawn support and payment. And like I said, I know from first-hand experience that this is going on. Now, I'm not saying it's in Canberra, but there are clinics that have, basically for financial reasons, started to refuse bulk billing and gold cards and white cards as well. So, it's an interesting denial of service. Now, quite obviously, the lady in the article here has encountered that herself, where her local practice has stopped providing the support. But, I mean, they're pointing out services that you can help you connect with professionals like that, like a website and a phone call. But for somebody who needs to go and see a doctor, that's not going to help. But, the counter to that, as it here, it comes from the RSL. And basically this is then the practical hands-on experience from the wounded veterans who are saying that, being able to find a clinic that will accept them. Now, finding one that accepts them I think they generally hang on to them like crazy at that point. But to find one that has open books, i.e. accepting new patients, and who accepts white and gold cards, So it's interesting that this comes up. I mean, because then this comes back into my, hobby horse about infrastructure support across Australia, particularly in regional areas, and support to various sectors of the population. It's good or bad. And It's telling as well. So in this case, it's pointing out the effect of regional Australia, and Canberra being, well, it's the capital city, but right there it's like, how does a veteran or another subsidised healthcare recipient find, say, psychiatric support when the psychiatrists are no longer receiving or accepting bulk billing patients or subsidised patients? So you're forcing them to go interstate to Sydney or Melbourne. That's quite an impost. That's not necessarily a great solution. It's a solution, but not a great solution. Now, a number of years ago, I knew of people who had to go to Sydney, had to travel hours and hours quite frequently to get ultimately what was routine treatment. Now, it's specialised medical treatment for conditions that they'd ended up with as a result of their military service. They weren't serving anymore, but they had to go to Sydney for it. And so that meant they lost days of work and everything else, when it should have been, they should have been able to send a local provider that for the hour or so it would have only been half a day of work lost as opposed to 2 or 3 every time they needed treatment. Now, they were on a salaried role, so they weren't actually losing pay, but it lost the workplace productivity. And if you're working in a wage-based, sorry, in an hourly wage-based environment, you don't get paid. You're going to run out of medical leave long before your treatment's finished. So, yeah, it's the hidden cost to the individual that happens because of this. So, it covers it. So the white card is specific medical issues only. So somebody who has, say, for example, psychological condition, white card, can't then get their treatment for a knee injury covered, or somebody who has like a parachutist, a military parachutist who probably has knee and back issues, can't then get a glaucoma covered by their white card. A gold card, covers all medical issues, and it generally represents the fact that the individual has complex medical needs that are only likely to worsen over time. So they get paid $76 for a GP visit. Now, I do know that some of the GPs set their private fees at $100 plus per visit. So you're not going to get, even within a practice, you've got some doctors who won't accept concession card holders, whereas concession cards, that's the word I was trying to think of, whereas others do. But they're accepting a loss of pay, and it's a goodwill. I've heard of specialists doing the same thing too. I know of a specialist who never served themselves, but feels like one thing they can do in terms of obligation to the country and everything else is provide their services to former defence members with concession cards, accept their cards as payment, basically. Now, you're talking about a specialist that's, even for an introductory visit, you're talking hundreds of dollars for a 15-minute visit, but is willing to accept white card and gold card patients. He's clearly not getting anywhere near what he would seeing a private patient, but he sees it as a form of obligation to the country, given that he never served himself. That's very few and far between, though. And yes, and this is coming out of the AMA, saying the Canberra ACT branch president, saying it's becoming a cost basis. It's becoming a cost problem, that they're not getting enough subsidised funding to do it. At the end of the day, if you can't afford to keep your place running, you can't afford to keep your place running. So, Yeah, easy solution is increased funding, but that's sort of same thing. Same problem is faced by Medicare as well, and yeah, so it's hard. And as they point out, it's hard for some veterans to change providers. So it's yeah. I mean, this article is obviously about veterans' healthcare, but it exposes a problem that affects all forms of subsidised healthcare, uh, and things like the NDIS, Medicare, other concession card holders. They're all facing similar problems of ensuring they get access to the same quality of healthcare as everyone else. Walk the problem all the way back to the first article, which was talking about the protests over the weekend. And again, this highlights the problem. We've got these struggles trying to accommodate and support existing members of the Australian community. And we're trying to bring in, under refugee conditions or otherwise, a swathe of immigrants who, and this isn't their fault, it's a situation they've come out of, who will often provide or result in an increased burden on the infrastructure in those regions. Okay, we've just finished talking about how difficult it is to access services for the existing population. Yet we expect everything to be magicked over the and it all to be working in sunshines and rainbows and happiness for the new arrivals. Doesn't work that way. It really doesn't work that way. Plus, even if they were providing input into the taxation system commensurate with the numbers of arrivals and to help fund things, adding extra doctors doesn't happen overnight. Adding extra hospitals, all this infrastructure takes years of lead time. I mean, talking of, again, this is an article I'd seen previously, talking of doctors in the ACT. There was an article talking about how the throughput of doctors, student doctors, it was also about New South Wales. The throughput of student doctors is about as much as the system can accept. And even then, there are some student doctors, while we're going for placement and internships and stuff, who struggle to find a position. So if you can't get the doctors through the training system to the point they're qualified and have a Medicare number, etc., then putting more into the education system isn't going to change things. So how do you get more through the system? The choke point seems to be the final stages of their training in the hospital system or in the existing healthcare system. There just isn't the capacity to have them go through. So if you've got a limit on the number of new doctors you can push through the system and new medical providers you can push through the system, you've got a cap in practice on the number of people you can feasibly support with your medical system. You need to fix that problem first if you want to then support a greater population. You need to fix your housing issues, your housing availability. Not just, oh yeah, I built a house 4 hours out in the middle of the boonies. It needs to have supporting infrastructure. It needs to have water, gas. Well, some places don't have gas supplies anymore. Water, sewage, electricity, council services, so mail, garbage collection, that sort of thing. Street lights, public transport, public services, public infrastructure, schools, medical services, shops, all that sort of stuff. Again, you can't just plop a house down and say, problem solved. These are almost generational problems. These are going to take years and years and years to get ahead of to catch up, let alone get ahead of the curve to the point that the capacity is there to support all this extra stuff. And then when you've got an aging population and the existing tax base is decreasing, you're trying to fund more with less, and inflation and everything else, it becomes a problem. And people are still taking the economic effects from COVID. Yeah, I mean, there's suggestions that some of the financial decisions made at that time by various governments might never get paid back. Yeah, it's an interesting thing. It's not as simple as saying you're a racist and don't want immigrants, or you want immigrants at the expense of the local population. It's not as easy as that. No. There's bigger problems. There's bigger problems. All right, enough on that one.